Over the past century, technology has revolutionized many industries, but one of its biggest influences has been in the healthcare arena. State-of-the-art equipment has greatly improved surgical techniques that only a few years ago would have involved invasive procedures and long hospital stays. New medications are treating diseases that we previously considered to be untreatable. One of the advancements in healthcare technology is the electronic health record, or EHR. Sadly, even with all of this progress, a majority of healthcare providers are still communicating via old-school methods: telephones, fax machines, courier services, and even the post office. Sending information through these channels is insecure, costly, and a burden on the environment. And sometimes, messages and records never even arrive at all. The worst part is that these communication problems adversely affect the patient's experience within the healthcare system. The resulting time lag all too often leads to incomplete treatment plans and unnecessary repeats of diagnostic tests, which can leave the patient feeling frustrated and hopeless. To illustrate this typical communication breakdown, let's take a look at what normally happens when a patient visits her doctor after a hospitalization. Eve is a 62-year-old female with a history of type 2 diabetes and high blood pressure. Both conditions are well controlled. She's on 4 milligrams of glimepiride every day and 20 milligrams of lisinopril twice a day. Eve was experiencing chronic right knee pain that forced her to quit playing golf, as well as most of her normal activities. 3 months ago, her physician, Dr. Primary, referred her to an orthopedic specialist in a larger city 40 miles away.
Hello, Eve. What brings you in to see me today?
Well, you sent me to see Dr. Goodbone about my right knee 3 months ago, and I had surgery last week at Big City Hospital to get it replaced. They made this appointment to get my blood level checked.
Okay.
You know, while I was in the hospital, they also found a heart murmur. They did an echo test and told me one of my valves is too small, but they also said it wasn't anything to be too concerned about.
I'm sorry, Eve. I haven't received that report.
Well, they said it wasn't that serious, but that you should send me to a cardiologist just to be sure.
We should probably get your records and test results from the hospital so I can review what the reports have to say, and then we can decide about sending you to the cardiologist. The nurse has recorded the medications you're taking. It says you're on a blood thinner?
Yes, Coumadin, half a pill at bedtime.
Do you know what dosage you're on, or did you bring your prescription bottle?
No, I'm sorry. I didn't think to bring the bottle. It's half a pill. Does it come in different sizes?
Did you get your prescription filled at Main Street Pharmacy?
Yes.
Nurse, please call Bob at Main Street Pharmacy. Inquire about what dosage of Coumadin that Eve has been given. Take this to the nurse. She'll send you to the lab to get your blood drawn. Please have our front desk set up a return appointment in 2 weeks so we can get your records from the hospital.
Sounds familiar, right? But it doesn't have to. These frustrating exchanges can be things of the past. The Health eShare Direct project is an electronic communication service that allows any healthcare participant, hospitals, labs, health departments, therapists, pharmacies, and even patients themselves, to send and receive encrypted medical information through an email-like service. The method is secure because a digital security certificate is attached to every direct email address. This certificate includes a pair of keys, one public and one private, to verify the identity of the user. Each message sent through Direct is automatically encrypted during transmission and unencrypted as soon as the recipient opens it. Direct differs from a health information exchange, HIE, in that no legal agreement between parties is required. Using Direct is no different than typing a letter or sending a fax, except in the sense that it's far more efficient and effective. While it may be tempting to use regular email, doing so can compromise a patient's personal information and therefore is a HIPAA violation that can bring stiff penalties. Direct uses authentication and trust verification to guarantee privacy. Remember that disorganized exchange between Dr. Primary and Eve? Let's watch that scene again, only this time with Dr. Primary using the Direct service instead of his old-school methods. It will show us how Direct can make a difference in the day of a doctor and to the life of a patient.
Eve, you're looking well after your surgery. How are you feeling?
I'm getting around fairly well considering. After you sent me to Dr. Goodbone, he decided I needed a knee replacement.
Yes, Dr. Goodbone sent me his consult notes via direct exchange. I also received from Big City Hospital your discharge summary and echocardiogram report. We'll check your blood today. Are you still taking your Coumadin 5 milligrams once a day?
Yes, I'm taking half a pill every night at bedtime.
Great. I'm putting an order in to check your blood level with a test called an INR. I'm doing this via direct through my EHR, so just stop by the lab on the way out and they'll send us the result this afternoon, also via direct. I'll upload the results to your personal health record, but I'll call you as well. It's important that your blood is not too thin. In that case, we'd have to adjust your dose. We'll have home health draw your blood for monitoring until you can discontinue the Coumadin. They'll send me those results electronically via direct, and I can make sure your dose doesn't need to be adjusted. I've also reviewed your echocardiogram, and it appears that you've developed a slight heart murmur. I'm sending a message right now, electronically, using direct to the best cardiologist I know. Dr. Heartthrob will take good care of you. This isn't an urgent issue, so we'll request an appointment in about 6 weeks, when you're getting around a little better. You'll send me a report by direct after you see him, and we can develop a plan for monitoring.
You can see how using direct can improve the quality of a doctor-patient interaction while shortening appointment times since the need to play catch-up has been eliminated. Direct also offers other benefits. For example, you'll lighten the administrative burden on you and your staff so you can focus more on your patient's needs instead of worrying about the paperwork. Furthermore, signing up for direct is just as simple as using it. First, your identity will be verified. Then you'll be assigned a specific direct email address, which includes the digital security certificate from a third-party certification authority. At that point, you can start sharing messages and information with other direct participants, whether you go through a secure email client, a web portal, or an MU2 certified EHR. Yes, it really is that simple. For more information on how you can become part of the direct revolution and to see if you qualify for incentives, visit healthesharetn.com or send an email. You, your staff, and your patients will be glad you did.